Friends, hello everyone. As always, we meet here on our channel, Healthy Movement. Here we talk about the health of the back and joints. With the help of exercises, we restore the health of our back and joints. And today we are going to talk about the neck. What syndromes are there? What exactly happens to us when we wake up in the morning and can't move our neck? Why can dizziness occur? And specifically, which muscles and arteries influence this? Why can our neck be curved forward like this, and what affects it? What structures and what posture? So don't switch channels. With the help of exercises, we will learn how to eliminate certain types of pain as well as posture defects. Subscribe and let's get started. Friends, there is one major syndrome related to the neck that causes many different symptoms and pains in the cervical region. Now we will break it down. This syndrome is called the forward head posture syndrome or upper forward tilt syndrome. This is a syndrome where our head falls forward, and as a result, the tension in the neck muscles increases. By the way, this syndrome is also known as text neck, or the neck of a person who reads a lot. Which muscles suffer in this case? First, the area between the shoulder blades suffers, and pain may appear there. Second, pain may occur in the area of our 7th cervical vertebra. Why? Because the trapezius muscles are constantly overstrained. Next, pain may appear in the neck extensors directly because when the head drops down, the neck muscles try to hold it up, but they can't do it because of overstrain. As a result, the short extensors of our head become engaged. They go into hypertonus, become more swollen, and can affect the vertebral artery, irritating it, which in turn can cause the artery's lumen to narrow. This is how we develop headaches, including dizziness. Next, against this background, the levator-scapulae muscle contracts because the shoulders and the inspiratory muscles located above are constantly tense. As a result, the levator-scapulae muscle can also experience pain. There may also be pain in the strap muscles that run along our spine. Accordingly, pain may occur when turning the head to the left or right. All of this is part of a single syndrome called the forward head posture syndrome. And today we will go over several exercises that first of all will help you return your head to its physiologically correct position, open up your shoulders, and only after that forget about the pain. Because first and foremost, posture causes overstrain in the muscles, which in turn puts pressure on nerve endings, as well as on the pain receptors located in our muscles. Together, we will achieve good posture, eliminate pain, and be healthy once and for all. Let's get started. So friends, first of all, we need to work on the chest muscle. You might wonder, what does the neck have to do with the chest muscle? In order to open up our shoulder blades and keep our shoulders in this position, we need to stretch the chest muscle so it lets our shoulders return to their correct natural position. That's why we will be stretching the pectoralis minor muscle. We find a doorway, place our arm like this in the doorway, and simply twist our body in the opposite direction so that, as you can see, the green muscle, the pectoralis minor muscle, can stretch. Accordingly, 15 repetitions on one arm, 15 on the other. All of this can be accompanied by exhaling as we stretch the muscle. Why do we need this? We need this, first of all, so that our overall blood pressure, arterial pressure, does not increase. Secondly, with the help of exhaling, our muscles can generate several times more potential than without exhaling. This means that the muscle can stretch more strongly. Our goal is to stretch the chest muscle so that the area between the shoulder blades can continue to be worked on and become stronger. Because if our chest muscle is holding us, then no matter how much we strengthen the area between the shoulder blades, the chest muscle will pull the shoulders forward and accordingly will not allow us to open up the chest. And this is exactly the foundation of good posture. So exercise number 2. Our task is to strengthen the strap muscles. They are located right here and their function is to pull the head back. I remind you, if they are too weak, the short extensors become engaged. In turn, they become hypertrophied and can affect the vertebral artery, which worsens the blood supply directly to the back part of our head. Therefore, how well developed and strong this muscle is will determine how much we can reduce tension directly in the occipital area. How do we perform it? From this starting position, on the exhale, move your head back. Note, not tilting it back, but simply moving it back, and then return to the neutral starting position. Again, move it back, then return to the starting position. I want to emphasize that you don't need to push your chin forward, you just need to return to the neutral position. Move it back, then return to the neutral position. The chin does not move up or down, and it is not pressed in. Do 15, 20, or even up to 30 repetitions like this. Make sure that your dizziness does not increase. Make sure that you do not develop a headache while performing this exercise. It is important to exhale with every effort. The tension occurs when you move your head back. So make your work easier by exhaling as you move your head back. And now the third exercise, friends, we stabilize the area between the shoulder blades and a little below it. Plus, we stabilize the latissimus dorsi muscle. The task of all these muscles is to lower our shoulders so that the inspiratory muscles, the upper part, are not overstrained and accordingly do not bother us or cause pain. Because right now when we feel pain, it indicates an imbalance. It means that the muscles that lift our shoulders up are too strong, they're overstrained, while the muscles that lower them are, on the contrary, too weak. Our task is to make the muscles that lower the shoulders stronger. Find a door frame, hold onto it with your hands and start the exercise. Starting position, hold onto the door frame. It's best to wear sneakers so your feet don't slip, because we'll be standing at an angle. As you exhale, pull yourself up, bring your shoulder blades together, and try to pull your elbows and shoulder blades downward so that your shoulders don't rise up. Keep your head in a neutral position. You should feel tension only in the area between your shoulder blades and maybe a little lower. Do 15 to 20 repetitions of these. If this is too difficult for you, you can decrease the angle of your body and it will become significantly easier. If on the contrary you want it harder, simply increase the angle of your body. With each lift, we exhale. Again, this is to prevent our blood pressure from rising and to make the exercise easier, as well as to increase the working potential of the specific muscles we're targeting. Friends, of course, you might have a perfectly reasonable question. Why are there so few exercises specifically for the neck? Let me explain. 95% of neck pain is caused by poor posture in the upper part of our body. For example, this kind of posture. That's why with these exercises we restore our posture to its physiologically correct position, and in doing so we relieve the tension from those trigger points that were causing you pain. So take this set of exercises for yourself. If you enjoyed this and found it helpful, subscribe to the channel, give it a like, let me know in the comments if it was difficult, and stay healthy.